Hi everyone, this video is going to show you how to navigate in SimChart to enter a patient assessment that you have in clinical, or in this case, the case study information that I give you will be pretty clear, and you're just going to take that data and enter it into SimChart. I am going to follow this rubric to grade it, just like your clinical instructors are going to do. So what you're going to do is follow the rubric, and what I would recommend students do, mostly because I'm old school and I print things out, is I recommend that you print out the rubric. Even when you go into clinical, print out the rubric so that you can write your information next to the rubric so that you know what it's looking for. Each class that you have, and sometimes each clinical rotation, will have a different rubric for you to use. The one we're going to use today is in your folder. It's the NSG 130 SimChart grading sheet. Now we're going to go into SimChart. This is Concepts Online this is the Fauquier campus NCO. So the Middletown campus says Virginia. So you're going to go in here, you're going to go over to the side where it says My Clinicals, you're going to get to the NSG 130, so the assignment, and we're going to click into it. It's going to look like this. I wish I could make it, there we go, so you can see the save button at the bottom. So you're going to enter the day that you went into clinical. You're going to put your patient's first initial, last initial, hospital floor, usually it's med-surg. We're going to say that our patient is a male. I'm making this up just to show you. 44 years old. And now I like this here, this one. My provider. You can tell I'm very creative. So we just use initials. Our initials come here. You can use student RN or RN. We're going to save this. This patient setup has to be done. Now, let's start looking at the rubric. Clinical setup, gender, age, initials, avatar. I've done all of that already. And now I need to get a code status in here for them. So I'm going to click code status. Order type, code status. You have to put a start date. You guys do not have to search the patient chart when you're in clinical to find a date. Just put today's date here. Okay, we're going to say that he is a full code. I'm going to add that order, and then see how it says nothing's here for code status. I'm going to submit the order, and now the code status is changed to 1 because he's a full code. You may have patients that are isolation types, so let's just do this. Even though it's not on the rubric, let's do it so you can see it's done the same way. Isolation. What kind of isolation will it be? Let's just put him as universal precautions. We're going to add the order. Whoops, look, I didn't put the start date. So I'm just going to put anything. Now I'm going to add the order. The order shows up, but it doesn't show up here until I submit the order. Many times students forget to submit the order, and then nothing shows up here, and guess what? When the clinical instructor comes to grade, they think you didn't do it, and they don't give you credit, and so you lose 1 point. So when we've clicked all of these and entered everything, we enter our drug allergies. Now, if the rubric doesn't say allergies, truly you don't have to enter it because they're not going to look at it to grade it. When we're finished here, we want to go over to this side. Think of these as filing cabinets. So we're going to look at number 2 on the rubric, and it says Preclinical Manager. So let's go to Preclinical Manager. Primary Diagnosis. So let's click that. And this is the page that shows up. Excuse me. So let's put cerebral palsy as a diagnosis. So I can click this drop down and try to find it, or I can enter. So if it's here, that's great. If it's not here, yeah, here it is. Or I can type it in. Got it? So we're going to put that it's primary. You can add as many diagnoses as you want. So once I save it, I could add another, and save it and add another. For the purposes of SimChart, you only need one diagnosis. So pathophysiology is what is wrong with the patient and have I researched it. So I'm going to write cerebral palsy can be caused by several various factors such as intraventricular hemorrhage. I spelled that correctly. I'm just going to keep going because this is just to show you, okay? Periventricular leukomalacia. And I misspelled that. Ischemia or hypoxia, infection. It can be caused by all kinds of stuff. And how did I know this? I'll do one more. Or brain injury during or immediately after birth. And maybe I learned this from reading a Smith article, 2017. So I've just done my in-text citation for what I have learned. If I want to quote something, I'll put it in quotations and put the page number. And one sentence won't cut it for pathophysiology. We want about a paragraph explaining what's wrong with this patient. So the patient's diagnosis is CP. CP can be caused by all kinds of reasons. This patient, so you can say my patient, suffered from an anoxic event 2 weeks after birth. This caused the brain damage that triggered the CP. Do you notice how I'm writing incomplete sentences? I'm using a reference for my pathophysiology because under preclinical manager on the rubric, I have to do pathophysiology, I have to do a therapeutic regimen, current health problems, but I have to cite sources for all components of the primary diagnoses. So let's pretend like that's a paragraph, and I'm going to go down here and I'm going to write my reference. And I'm going to do it in APA, and really I'm not because I'm for time's sakes, right? Smith, 2017, blah, 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 pages 4 through 5. There, that's my reference. But you guys are going to have to write a full reference out. For my therapeutic regimen is what are we doing for this patient? What is being done to help him? Now, cerebral palsy is a long-term disease, but if this patient had a hip fracture, the therapeutic regimen would be something like pain meds, surgery, physical therapy, maybe a walker until he can walk correctly. For cerebral palsy, since I started with that, I'm going to say the patient requires ongoing physical therapy, special shoes, and leg braces to prevent falls. So that's the therapeutic regimen for this patient. Oh, and he also requires muscle relaxers. Whoops. You guys are learning that I don't know how to spell. Muscle relaxers, there, for the pain. I wrote incomplete sentences. Some people historically have just listed medications. Therapeutic regimen is so much more than giving drugs. It's the whole thing of why are you taking care of them? What are you doing for them? Okay? And I may have to read something and reference this as well. So then I would just write the reference down at the bottom. The reference could be the same exact reference that I used up here, so I would just cut and paste it down here. Current health problems and related functional changes. The document that I've posted to help you get into SimChart goes into detail with how to write your current health problems and related functional changes. So I'm still going to write in complete sentences. Current health, oops, what did I do? Current problems deal with mobility. The patient currently has a broken coccyx due to fall. Due to a fall. The patient requires total care with regard to transfers and ADLs. So current health problems, he's got cerebral palsy, that's his primary diagnosis, but he has a broken coccyx. So that's his current health problem, but his related functional change is he requires total care. That's a functional change. He requires somebody to help him with his ADLs, help him with transfers. Maybe he could do it before. If I'm using a reference, I'm going to maybe copy it down here or write a new reference. I might quote something. Many times you don't have a reference in current health problems. It's usually up here in the patho. And the patho is the longest portion of this. You're going to write in complete sentences, and when you're finished, you're going to save it. And if I wanted to add a diagnosis, I would go here and add something, or I would add here. Either one gets you to the same place. Okay? So now I'm on components of cardiovascular assessment. That's number 4 on my SimChart. So I'm going to go to, in my SimChart rubric, so I'm going to go to patient charting, and I'm going to click systems assessment. So this opens the folder, and this opens the little place that I need to be, systems assessment. And I encourage you guys to look in all of these areas. Your Find Me assignment helps you know what's located in all of these areas. Here, you're mostly going to use your systems assessment. So we're on cardio, so I'm going to click cardiovascular assessment. We're never going to put no assessment required if your rubric calls for an assessment. Does that make sense? You won't get the points if it says no assessment required. So pulses. Pulses. Apical was regular for this patient. There was no murmur. Now, some students think that you have to check pulses all over, and I'm telling you no. Radial, radial. So if it was normal, now for my 106 class, I tell you that you're going to see in electronic medical records, you're going to see 4+, 3+, 2+, 1+, 0. You're going to see these numbers sometimes by themselves. You're going to see words sometimes by themselves, and you have to know what they mean. So 2+ is normal or expected. I'm going to put that. Doppler means you couldn't feel anything and you had to use a Doppler ultrasound. Okay, now I'm going to go to this side. And I'm going to do, that was normal as well. Then I'm going to go down here to the feet. So here's the thing, guys. If I have a pulse here, I am going to have it here. If I have a pulse here, I am going to have it up here in the femoral area. I'm going to have it here. But if I just check pulses here, I may lose a pulse going down the leg and I may not have it here. So when you guys have to check pulses, do radial and then do pedal. And then you're good, okay? So check pulses. Tissue perfusion is the next thing. So I don't have to do any of this stuff because it's not called for. I'm going to tissue perfusion. Mark all that apply. This guy has warm extremities. Nothing else. Edema. No edema. Capillary refill. Capillary refill's good. Less than 3 seconds. That's good. So I've done all of this capillary refill. And even though there's other stuff on this assessment, this rubric doesn't call for anything else to be done. So if I do it, it's for myself. And what I like here is there's some interventions. I'll click this and show you. There's some more interventions if somebody needs cardiovascular care. Like if I want to put anti-embolism stockings on them, I'm going to click that because they have intervention. So if you have a patient in clinical that has anti-embolism stockings, just click that to show that it's there. Okay, but I'm done now. I'm going to scroll down here and save that. After each section, I'm going to save it. So it's saved my cardiovascular, and on my rubric, I go to respiratory. Respiratory says respiratory pattern. Here's the pattern. Look at all these choices. You guys need to understand what all these choices mean. What does stridor mean? Tachypnic, what is that? Bradypnic, what is that? I'm just going to give him normal. He's normal. That's his pattern. His effort. Does he use accessory muscles? Is he short of breath? You only mark what applies. Right? So his pattern is even. But he's normal. None of this applies. I'm not going to do anything. Okay? Now, there's nothing to check for lung auscultation but I'm on this rubric. But if I click an area of the lungs where I've listened to his lungs, I'll mark what I hear. And these are choices. These are common terms to describe your respiratory assessment. And you would choose, and it would be different in each area. So you would do all of these areas if you had to do lung auscultation. My rubric says oxygenation. Let's pretend like he's on oxygen. Oxygen in use. So it's liters per minute or percent. Usually it's liters per minute. We're going to say he's getting 3 liters per minute. The way to understand the percentage is room air is 21%. And every liter you give above room air is 3. So if he's got 3 liters on, he's got 21% plus 9, so he's on 30% of oxygen. So I could have put 30% here. Hope that trivia helps you someday. If there were any notes about the oxygenation, like it has to be humidified, I would put it down here. But I'm finished with respiratory, so all they wanted to know is pattern, effort, and oxygenation. So I'm going to save it. So we keep going down each section until we're finished filling in each section of the systems assessment that our rubric calls for. So only do what the rubric calls for. I keep saying that over and over again, and I tell students that over and over again, and they'll still spend so much extra time doing more, and you don't get any brownie points. I mean, I want you to just do what's needed, but also know that embedded into SimChart are fall risk assessments. There's education regarding the different pain scales that you'll use in your career. So there's lots of good learning stuff if you want to search around for different things, okay? So now the assessment is one part of SimChart, so you're going to go do that. And then when you're finished doing all of the assessment stuff, you're going to get into your nursing diagnosis. So let's go to Care Plan, because that's where you're going to enter nursing diagnoses, okay? Care Plan looks like this. So you're going to enter your medical diagnoses. There it is. And when you enter your medical diagnosis and you mark the button that it is, you can either hand text it in here or choose from the drop-down list. The students that aren't prepared to enter their care plan and sit here doing their SimChart at the last minute and just choose things from the drop-down sometimes do not get all the credit, because they're randomly choosing stuff and they're not choosing realistic things that work for the patient. So for this patient, I might be able to get a good care plan on the drop-down, so that's what we're going to do. Your first nursing diagnosis needs to be your actual, so let's choose an actual. He's got a bathing self-care deficit, right? If you remember with the functional changes, he can't bathe himself. He needs help. So I'm going to put bathing self-care deficit as his actual. And that may not be the big thing for him. He may actually have pain, or he may actually have a big mobility impairment. You have to choose the most important. The purpose of this exercise is to show you how to enter into care plan, so I'm randomly choosing that since it was the first thing that popped up. But when your clinical instructor is grading your ability to choose nursing diagnoses, you need to choose the priority actual nursing diagnosis. And I'm telling you right now, this one isn't. Okay, so I'm just showing you how to push the buttons. Bathing self-care, actual, the related to. So I can either click some things. So it needs to be appropriate, realistic, and directly related to the patient. I might hit anxiety. This guy's not anxious. I could click anything. I could click related to pain associated with his, oops, I misspelled it. Oh, my spelling is so bad. Pain associated with his fracture. And look, that added in. So I could do a combination, drop down, plus I could add my my pieces for the related to, as evidenced by. There's lots of choices. Inability to wash body. There you go. Remember, with a nursing diagnosis, the evidence by is what you see or what the patient tells you. Patient states, it hurts when I bend to wash myself. Anything. You see, I'm adding it and it goes right there. So your evidence by. So I've done the related to, I've done the evidence by, and now I want to do some expected outcomes. They need to be appropriate and realistic, and I have to identify one outcome for each nurse. That's what the rubric said, or for each nursing diagnosis. That's what the rubric said. So my outcome will be, he'll bathe with assistance, and I have to enter a measurable time frame. My measurable time frame is going to be during my shift. It could be before discharge. It could be within a week. It could be in 2 days. It is not going to be some unknown length of time. It's not, I don't usually even like by discharge because you don't know if that's going to be 2 weeks or 3 weeks or whatever. But so one outcome there, if I had to manually enter something, like all those J's right there, it'll show up down here, and there'll be a spot for me to put a measurable time frame. So you always need to have a measurable time frame, okay? My rubric says appropriate, realistic 4 interventions that I attempted to implement for each nursing diagnosis. And I have to do cited sources for the interventions. So what I'm going to do is I'm going to allow the patient to participate as able in bathing, rationale. I'm going to look in my nursing diagnosis book and it's going to say patients should bathe themselves. And I'm going to reference them down here. So that one's good. And then I might arrange the bathing environment. And the rationale is this allows the patient to be more secure or something like that. And I'm referencing it. It could be the same exact reference. The Middletown campus can come into my office anytime. On my top bookshelf, I have a bookhoodle of nursing diagnosis books that people can borrow. I'm happy to bring one down to Fauquier if any of you need to borrow a nursing diagnosis book. We used to require that students buy them. We don't anymore, but they're very helpful. There are nursing diagnoses in your fundamentals book and in your med-surg book when you start researching your medical diagnoses. So until you learn the interventions that go with specific diagnoses, it's good to research them. You can look online and find nursing diagnosis for different illnesses. What I like to do is don't do this drop down. You think about your patient that you took care of, and what did you do for them? Did you help them to the bathroom because they couldn't walk? If you did, then they have impaired mobility. Did you have to help reposition them or give them pain medication throughout the day? Then they're in pain. That's a nursing diagnosis. I know you guys don't know these diagnoses, but you will as you move along in your nursing program. And when you start working, you'll understand what is a NANDA-approved nursing diagnosis. Now you have to look it up. But I like to find diagnoses. I like to start with, what did I do for the patient? Was I administering his oxygen, letting him rest, listening, assessing his lungs and his vital signs because something was wrong with his lungs because he had impaired oxygenation, impaired gas exchange? Then that would be your nursing diagnosis. But the implementation or the interventions were frequently assessing his status, administering prescribed oxygenation, providing frequent rest periods between activities, assisting the patient bathe himself because he was weak. Those are 4 interventions for somebody who is weak. This person who has difficulty bathing themselves, the interventions are easy, right? I'm going to assess his ability. I'm going to ask for his bathing habits. I'm going to write rationale each time. You'll love this. Here's my rationale. Care for himself. Here's my rationale. And then I'm going to save it. So bathing self-care deficit is my first one, okay? And I did the drop down for everything, but I've got to add another care plan because I have to add a potential for. So if somebody has, and I start all over again, right? cerebral palsy. I have to think, what is my potential for? And it is going to be I'm going to add new because there's injury, but I really want it to be potential for falls. So that's a potential related to. Now when I add, you notice I don't have any drop downs, so I've got to write it all, okay? And I don't write in this box. I have to enter my text here and hit add, and then it pops up to the top. So related to I could say medical diagnosis of CP. Then I've added it up there. I could add something else related to unsteady gait, which is really the same thing, right? Unsteady gait, medical diagnosis, related to pain and use of narcotic pain meds for recent fracture. This is all true. Some of them are related. I'm just showing you all the things you could add, how to add, right? As evidenced by. So when I enter it myself, and some people like to do that, they like to research their nursing diagnosis, do their related to, do their evidence by, and just enter it, and it truly makes more sense. So I'm an advocate of this too. As evidenced by unsteady gait, I was going to say unsteady gait, expected outcome, there you go, okay? Interventions, I have to have at least 4 with rationale. I've got to enter them myself, okay? Call bell within reach at all times. I'm going to write where I learned that, what book tells me, and for nursing school, you want to have a reference for every intervention, even though it seems common sense. I had a student once who was taking this class who wrote, my rationale came from my brain, so I put my brain on there. Yeah, a lot of these are common sense, but try to find support in the book somewhere because this exercise asks you to. So I hope this teaches you how to do your nursing diagnosis. I'm going to show you one more thing. Oh, it's not wanting me to finish because I didn't put any rationale in here. So it makes you put a rationale for each intervention, and it might not accept this. I'm going to go ahead and cancel. Because I already have one care plan. So I'm just going to keep this one care plan, but you guys are going to have 3 when you're really doing this. Now, some of the sim charts, some of the rubrics, are going to ask you to evaluate your diagnosis. And do you see how I just clicked it like that to open it up? This is how I evaluate. I go down here and I click evaluate. And the way you evaluate is, was my outcome reached? Yes, it was reached. Was my intervention effective? That one was effective. That one was ineffective. And that one was effective. And now I'm going to save it. And I'll go back in and look, and it gives me green lights for good, Red means that didn't really work, so let's just get rid of that and do something else. I don't have to do anything, I just have to evaluate. So if your rubric tells you that you have to evaluate, that's how you do it. You hit the evaluate button down there, okay? So this is in a nutshell how to enter a SimChart. Follow that rubric. Walk down this and enter. If you have any questions, I will help you. I will meet with you. This exercise was just to show you how to enter in SimChart, not how to choose or do the assessment, but just how to enter. And I hope it was helpful. 35 minutes long. Sorry it was so long.